All right, yesterday I put a little tweet out there about, rotator cuff injuries are something very common, and the fact that I don't think they're caused necessarily by bench pressing or behind the neck presses, as some people seem to believe. In fact, I think it has to do, in many cases, to at least a background of a very poor diet. And as a surgeon, rotator cuff injuries were incredibly common in an orthopedic surgery practice. Probably if I saw 50 people in a day, 10 or 12 of them would probably have a rotator cuff tear of some sort, perhaps even more. Probably more that weren't in there for that specific purpose, but certainly a lot of them were part of my patients, and almost none of them engaged in weightlifting. By far the majority of them were just, maybe they just had pain just day to day, or sometimes there'll be a trauma, they fell or they picked something up, but they generally weren't engaged in lifting. And so why might we see this? Okay, so here's a nice paper on the relationship with shoulder issues in general, and I talk about rotator cuff tears and diabetes. And certainly diabetics have a tremendously higher rate of shoulder issues compared to the general population. And one of the proposed mechanisms is that they tend to have the development of something called an AGE, or an advanced glycation end product. And essentially what's happening is sugar mixes with the proteins, and we end up with this degraded tissue. Now, it's a similar, AGEs are formed when we cook food. You'll hear about that you can consume them. Like when you brown a steak or brown bread or brown vegetables or anything where you brown something, what happens is the sugars and the heat combine to make this sort of, so-called Maillard reaction, which makes the food taste good in many cases. But the reality is consuming that has a very minimal impact. It's broken down by our digestive system. It doesn't really, have the impact that marinating our tissues in high levels of glucose, right? So when we have higher glucose levels for periods of time, and we, of course, we have body heat going on, that combination tends to lead to glycation of those very, very tissues. And then eventually with time, if you stick a camera in someone's knee, which I've done thousands of times, a young person, that cartilage will look pristine white. It looks like freshly fallen snow in color, in fact. But you get somebody in their 40s, 50s or something like that, and all of a sudden it looks brownish, dark yellow brownish. The surface isn't as nice, and so there's some glycation that's occurred in that situation. Interestingly, I just had a discussion yesterday with a Professor Philip Prims, who is out in Pennsylvania, and he's an exercise physiologist. He's been doing a lot of studies looking at athletes on high carb versus low carb diets, and one of the things he's finding out that the low carb diets in the studies, once they're habituated, are actually in some cases outperforming those people on high carb diets, which goes against obviously the standard dogma of carb loading and so on and so forth. But one observation they had was that in the high carb cohort, the athletes, these are lean, fit, in shape guys and gals, that almost 50% of them demonstrated blood glucoses which were in pre-diabetic ranges, or they would have numbers that were quite high. You didn't see that in the low carb group. So even if you're physically fit and lean, if you're having these significant blood glucose issues, you may be exposing yourself to elevated glucose, which may be, again, setting up this concern around advanced glycation end products. So it's an interesting thought. Like I said, diet. You think about diet impacts your tissue quality. If your tissue quality is compromised, then relatively minor traumas lead to increased rates of injury, right? And then poor healing characteristics as well. We know, like for instance, vegans don't heal as well. There's papers that show that, particularly things like surgical scars, surgical incisions, they don't heal as well. So having high quality nutrition, not having high blood glucose excursions, probably results in more robust, healthier tissues, probably greater durability, greater resilience, but greater capacity to heal, and so on and so forth. So anyway, something to think about, guys. I am off to Oregon today. We're going to a place called Cannon Beach. Maybe some of you have been there. I haven't been there before. Our trip to Egypt, which we were supposed to be in Egypt right now, but because of the sort of the conflict in the Middle East that's going on right now, it was not a particularly good time to be in that part of the world. And so instead, we're going to do a small trip down to the Oregon coast, spend a couple days there. I'll update you guys when we get there, and hopefully have some nice footage of some pretty scenery. Hopefully, it should be pretty nice. Anyway, you guys have a great day. We will talk to you real soon. Bye-bye.